The Trump administration is taking aim at ultra-processed foods as part of its mission to make America healthy again. U.S. Health Secretary Robert F. Kennedy Jr. has identified these foods as a major contributor to the nation's growing epidemic of chronic diseases, including obesity, diabetes, and autoimmune disorders. During his Senate confirmation hearing, Kennedy described ultra-processed foods as poisoning Americans, especially children, and vowed to remove them from federal programs like the Supplemental Nutrition Assistance Program, SNAP. "I will do everything in my power to put the health of Americans back on track," Kennedy declared. The impact of ultra-processed foods such as sugary cereals, frozen pizzas, chips, sodas, and ice cream, make up about 60% of the average American diet. And for children and teens, the figure rises to nearly 2/3. Studies have linked these foods to serious health conditions, including heart disease, depression, and even an increased risk of early death. However, nutrition experts caution that while these studies highlight correlations, they do not prove causation. Food manufacturers argue that processing improves food safety, extends shelf life, and provides an affordable, diverse diet. Defining ultra-processed foods, most foods undergo some level of processing. However, the term ultra-processed refers to industrially manufactured products containing additives, artificial colors, and preservatives not commonly found in home kitchens. Nutrition researcher Kevin Hall from the National Institutes of Health, NIH, notes that while many packaged foods fall into this category, not all are unhealthy. Items like whole grain bread, yogurt, and tofu are highly processed but also nutritious. Health risks and scientific debate. A groundbreaking 2019 study conducted by Hall and his colleagues found that participants consuming ultra-processed foods ate an average of 500 more calories per day and gained 2 pounds over 2 weeks, compared to those consuming unprocessed foods. Despite such findings, experts agree that more research is needed to determine the exact mechanisms behind these health risks. Should ultra-processed foods be regulated? Some health advocates argue that existing research is sufficient to justify regulatory action. Proposals include higher taxes on sugary drinks, stricter sodium limits for manufacturers, and restrictions on marketing these foods to children. Former FDA Commissioner Robert Califf previously acknowledged the complexity of the issue, emphasizing the need for strong scientific backing before implementing widespread policies. Practical advice for consumers experts suggests that rather than completely avoiding ultra-processed foods, consumers should focus on checking ingredient labels and following dietary guidelines. Reducing added sugars and sodium while increasing intake of minimally processed fruits and vegetables can improve overall health. Aviva Musicus of the Center for Science in the Public Interest emphasizes that food choices should not be moralized. Foods should be joyous and delicious, she says, recognizing that not everyone has the time or resources to cook from scratch. As the Trump administration moves forward with its health initiative, the debate over ultra-processed foods and their regulation is likely to intensify.